Welcome to Tees Voices, telling the stories of the people in our NHS community.
I'm Elliot Kennedy, and in studio today we've got Lexi Hurst, who is a specialist screening practitioner here at North Tees.
Hi there.
Well, what's bowel cancer screening and why is it so important?
So bowel cancer screening is a test that you do at home and it checks for signs of bowel cancer. It's offered to everyone from aged 50 to 74 at the minute in the Tees area and the postal kit comes every 2 years. And it uses a test called a fecal immunochemical test, which we call a FIT test. And that looks out for blood in a sample of the stool, as this could be a sign of bowel cancer. You collect the sample at home and send it by post to be tested. And it can help find cancer early and before you actually have any symptoms, which may mean that it's easier to treat.
So what happens if the test comes back showing blood?
So if the FIT test comes back abnormal, patients would be booked into an assessment clinic to see ourselves and discuss having further investigations. So these could be a colonoscopy or in some cases a CT scan. During this appointment, we'll ask for information such as past medical history, medications, and any bowel symptoms that someone may be experiencing. Our job is to provide information, reassurance, and to assess a patient's fitness for further investigations, really. Blood in the stool, it doesn't necessarily mean that you have a bowel cancer. There can be lots of other reasons for bleeding in the bowel, such as hemorrhoids, medications, or something called bowel polyps.
So what is a bowel polyp?
So bowel polyps are little small growths on the lining of the bowel wall. They are very common and not usually serious, but sometimes they can lead to a bowel cancer. We see bowel polyps in approximately 60% of our patients that come through bowel cancer screening. We're able to remove most simple polyps during a colonoscopy, and that involves looking at the bowel using a camera on a long flexible tube. Polyps don't normally cause any symptoms, so most people with polyps don't actually know that they have them. And this is why we appeal to the public to complete their home test kits before they have any symptoms. Polyps are normally easier to manage, whilst earlier in the development. And if they're left in place for a good number of years to grow, then this is when they can change into something like a cancer.
So how treatable is bowel cancer today?
Statistics show completing a bowel cancer screening home kit can actually reduce your risk of dying by bowel cancer by 25%. If a cancer is found during an investigation, we're able to refer these patients urgently for further tests to look at treatment options. Treatment can depend on a number of different factors, including how much the cancer's grown, whether it's spread anywhere else in the body, and a person's general health. A team of doctors, nurses, and other health professionals will discuss the best treatment and care for the patient, prioritising patient choice throughout. And these treatments could consist of surgery, chemotherapy, or radiotherapy.
I suppose the most important question is there anything that we can do to reduce the overall risk of bowel cancer?
Yeah, we don't know what causes most bowel cancers, but we do know that some factors can increase your risk of getting the disease. Some of these things you can't do anything about, for example, age and genetics, but you can make changes to your lifestyle to lower your risk of getting bowel cancer. Scientists believe approximately 54% of all bowel cancers can actually be prevented by having a healthier lifestyle. It's important to ensure a good diet, including lots of fruit, vegetables, fibre, protein and healthy fats. Staying hydrated, which, drinking about 1.5 to 2 litres of fluid per day would be good. And it's important to be physically active every day, limiting alcohol to no more than 14 units per week and not smoking.
Lexi, thank you.
Thank you.
Thank you for joining us. Till next time, you've been listening to Tees Voices.